Hello, Professor. I am Jodiann Allen,
And I'm Keita Bosket.
and today we're here to present our biology group project on oral candidiasis.
In other words, thrush. I know you may be wondering, well, what is thrush? What is oral candidiasis? It's a fungal disease, a yeast infection of the mouth, and this is most common with people that have delicate immune systems. For example, babies, individuals with cancer, diabetes, and even AIDS. Thrush is a single cell fungus. That means it's a eukaryotic cell. So that means that the body maintains the even numbers of microorganisms, but sometimes when the immune system is weak and the microbes have lost its balance, moisture would begin to form in the mouth and throat, causing thrush, oral candidiasis. Some of the signs and symptoms are white and yellow patches on the tongue, redness or bleeding under the patches, a bright red tongue, in other words, meaning it's very sore, and you may have problems tasting your food or even swallowing. If you feel these symptoms, it's best that you seek professional help. And some other symptoms that you should look out for is dizziness, if you're very thirsty, if your urinating is little to none, and also if you can't eat or drink anything. Some of the treatments that the doctor may provide is an antibiotic, or something as simple as you just removing the white, yellow patches from your tongue. And if you're breastfeeding as a mother, it's best that you stop breastfeeding so that you and the baby do not give it back and forth to one another. It's best to stop breastfeeding and take care of the thrush that may be on the baby and on you as the mother as well.
And another form of treatment, which is very simple, is that you can also use a cotton swab to remove the bacteria from the tongue.
Right.
And in other cases, a healthcare professional can also prescribe an antifungal medicine.
Clicker question time. So with the cell being eukaryotic, does it has a nucleus and a cell membrane?
A, true, or B, false? So
Well,
remember, guys, a eukaryotic cell has a nucleus. The
right.
prokaryotic cell does not have a nucleus.
Awesome.
So in other words, the answer here would be true. Right or wrong?
It's false.
Okay.
Because eukaryotic
That was
cells,
the trick. Yes.
right.
That was like a trick
Eukaryotic cells does have a nucleus and a cell membrane.
Got it.
False.
Now, for the epidemiology part of this disease. So this is the graph that we're using to talk about the statistics. So the red section here, it shows the percentage of babies that come in contact with this disease, 5 to 7%. The green section here tells us how much percentage of people that has HIV or AIDS that come in contact with this disease. And that number is 9 to 31%. This is how bad this disease is. However, it's not that bad for HIV/AIDS as opposed to people who have who are generally healthy adults. As you can see down here, 30 to 45%, this big purple area of people who are generally healthy adults,
Right.
that is, they can get this disease. And so we are going to talk about the yellow portion here. It's close to 20%. And this is for cancer patients. So people who are at higher risk are cancer patients and generally healthy adults. This is kind of a little bit tricky because we wouldn't imagine, who would imagine that general healthy adults would fall into this bracket? We would be thinking that it would be like people who have an underlying medical condition, but the statistics don't lie. You know, as you can see, we actually got this information from the authors Patil S, Ro R.S. Manjumdar, and Anil S. And this was, the statistics came into effect 2015, so it's pretty recent. So yes, and as Keita explained in the earlier slides, this is an oral infection of the mouth, and you know, as we said, it can be caused by not brushing your teeth and a lot of other easy, simple, everyday stuff
Right.
that you need to be doing to keep healthy. So guys, brush your teeth, take care of your oral hygiene. Now, the lifespan of oral candidiasis. In some situations, thrush can last for 1 to 2 weeks if being treated properly. But if the oral candidiasis have spread and not being treated, it can last for as long as 6 months to a year. And it can even become fatal.
Right.
Now, if we're going to go deeper in this disease. So this is a photo of what the virus, the fungi looks like in our bodies, you know, in your bloodstream and so forth. So this is when it becomes invasive. The
Right.
invasive candidiasis is a severe infection, which is caused by the yeast, Candida. So Candida is the yeast that actually causes the infection. But unlike oral candidiasis, it can travel to other parts of the body.
Right.
It can go inside your bloodstream, your esophagus, your brain, eyes, vaginal or genitalia.
Mm-hmm.
And we're going to talk further on that.
So once the thrush get into the bloodstream, it, as Jodiann mentioned prior, it could become fatal, and it will cause other symptoms as far as fevers, chills. It can even make you go into a shock, low blood pressure, your heart rate may increase, and you may even have shortness of breath. So it's best that you treat it in advance, because once it starts to travel, it's not good if it's in your blood.
Yes. And Keita, I just want to touch a little bit on that. So sometimes, you know, all these symptoms that you just mentioned about having candidemia, that's the thrush in your bloodstream, guys, you might be having these symptoms and you're wondering, oh, it might be a little flu, it might be a little virus or whatever. But sometimes it's more than that. It could be thrush. It took over a lot of other areas of your body without you knowing. So there's no way for you to actually know for sure unless you visit your healthcare provider and they diagnose you with that.
Absolutely. So once it become a yeast infection, then that's when it can be transferred to your partner. And if and vice versa, depending on who may have the thrush. So in vaginal yeast infection, there may be inflammation, intense itchiness, and even a white, thick discharge that comes from the vagina. Also, you may even feel sick and nauseous. But a way that you can go about preventing or stopping the yeast infection from spreading or transferring it to someone else is best that you get an antifungal medication to treat it. And it may take up to 3 to 4 days to calm the infection down, but once you start the treatment, it should go away. And as far as males, it's the same symptoms. They may experience itching or burning or moisture in the private area, discharge as well, and even swelling. So it's definitely best that you, if whomever come in contact with it, that you get the antifungal medication.
Yes, definitely. So, guys, as I said before, oral candidiasis, the subject is pretty much diverse because, yes, we started out talking about oral, but candidiasis can take over more parts of the body. So now we're moving to the ocular part of it, candidemia, the eyes. So if you have blurry vision, floaters, photosensitivity, and ocular pain, all of this can be resulted from having the underlying disease, which was the oral candidiasis. So oral candidiasis actually can progress into ocular candidemia and other diseases that are related. Also, there is esophageal thrush, that is, thrush in your throat, all the way down in your throat. And this is when the oral candidiasis is left untreated and it progresses from the mouth, from the outer mouth or the very inner part of the mouth to all the way going down in your throat. And then this can lead to a whole lot of other stuff, but we're not going to go into all of that. So some of the symptoms of the esophageal thrush are like white lesions on the lining of your esophagus that may look like cottage cheese. That can't be good. You may have pain or discomfort when swallowing. It's like a sore throat, extremely dry mouth, difficulty swallowing. You might have a little weight loss here and there. You may have chest pain. And of course, as we mentioned before, you may not be thinking that is the oral thrush, but yes, if you have any of these symptoms, please visit your primary care physician. And thrush can also cause memory problems. So when thrush enters the brain, the scientific name that we give this is Candida albicans. This causes memory problems, brain abnormalities, and it resembles characteristics of Alzheimer's disease. So guys, this is a learning lesson for all of us. We need, if you are experiencing any of these symptoms, please get tested. We need to stay healthy.
All right, clicker question time. So if thrush is not properly treated, what are some of the effects? A, photosensitivity. B, discharge that look like cottage cheese and might have a
bread-like look.
Right. Rapid breathing, memory problems, or all the above.
Hello, everyone. So like we previously learned in the previous slides, let's see, photosensitivity is one of the symptoms that you can definitely encounter when you have the thrush. So we'll mark off this one. We'll mark off question, answer choice A, and then answer choice B states a discharge that looks like cottage cheese and may have a bread-like look also. So we know that this is true. Even the cottage cheese look, even though we did not mention the bread-like look in the previous slides, but it is actually correct. So let's eliminate answer choice B. And now moving on, answer choice C states rapid breathing, also known as shortness of breath. This is also true. And in answer choice D, thrush can also cause memory problems. So yes, we're going to go ahead and mark off answer choice D. And then we have answer choice E, the last one, all of the above. All of the above, we say they're true because they are. So the correct answer is answer choice E.
All right, and some ways that you can prevent from thrush taking place. As Jodiann mentioned before, guys, we have to take care of ourselves, our hygiene, make sure that we're going to the doctor regularly, making sure we're washing our hands, because these are little simple ways that you can prevent it even getting that far. Just brushing your teeth and your tongue And then make sure you're brushing before going to sleep. That's so important. Also, see your dentist regularly whenever you get your cleanings. And also, if you have babies, make sure you're sterilizing bottles, toys, anything that they may put in their mouths. Just make sure you're keeping it clean at all times. And for, some people that may be experiencing diabetes, it's best that you keep your blood sugar under control, because that can also cause the thrush to progress.
Definitely. And I just want to touch on one thing here, Keita. So in this part where you said they should sterilize the bottles and nipples and so forth for babies, actually some people, they will actually go ahead, follow all the steps, boil everything and so forth, and when the thrush is there, but after the thrush is gone, they don't follow up with that. And it is
Right.
very important, guys, that you boil
Right.
everything again after the thrush is gone,
Right.
because it can rebound very soon. So you
Absolutely.
got to keep boiling everything after it's gone, for some time, more like maybe another month, 3 to 4 weeks or so that you're sure it's gone, and you take it from there.
Absolutely. Well, all right, guys. That will sum up our presentation, and the next couple of slides are all of the resources that we used in order to present you guys with this amazing presentation. I hope you enjoyed, and I really hope that you got all the information you needed to know about oral candidiasis and thrush. Is there anything else you wanted to say, Jodiann?
Thanks